Dory is a friendly, optimistic blue-tank fish in Finding Nemo. The movie is set underwater in the ocean. For some background, she suffers from short-term memory loss, affecting her ability to remember directions, people, and conversations. Due to her memory difficulties and in relation to the cultural context of both the open ocean, if Dory went to a fish therapist, she would be diagnosed with anterograde amnesia, which is the inability to form new memories after an event that caused the condition. The cultural context affects diagnosis because, as Gutches and Cho mentioned, um, different cultures emphasize different memory types, and cultural practices can change how it is perceived. For instance, the West has independent and analytic thinking, while Easterners have a collectivistic culture. This difference can cause the disorder to be interpreted differently across cultures. Some stigmas include social isolation, frustration, and caregiver emotional burnout. The DSM describes integrated amnesia as a form of memory impairment involving and difficult forming new memories and retaining recent information. Dory demonstrates this as she has a hard time forming new memories. For instance, in the movie, Dory was leading Marlin towards the boat, but then she forgot she was leading him and questioned why he was following her. Another example of the symptom she displays is when she rapidly forgets newly learned information. For instance, she almost immediately forgets to tell Marlin to go through the trench and not over it, even though the sea of fish told her a few seconds ago. One symptom she does not display is language impairment. She is able to talk to others and has strong communication skills. One empirical paper that has these symptoms is by Warren et al., who followed a patient with hippocampus damage over 18 years and measured her ability to form and retain new information, such memories. They found that her memory loss was linked with difficulties in daily life, like maintaining a daily routine and managing tasks independently. Therefore, it shows that the memory problems that Dory has are real and relate to meaningful real-world outcomes, demonstrating significance. I think Dory would benefit from repeatedly recalling information like direction, names, and other important information with time in between the reminders and recall increasing. This repeated treatment can help because it helps encode information and strengthens it through consultation and makes it easier to retrieve later. There are no ethical concerns. The only barrier I can think of is inconsistent support, societal barriers. As other fish may not understand or get frustrated with helping her, the empirical source O'Kane et al., which studied hippocampus amnesia and how patients with severe memory loss supports this, because they found that even though the episodic memory is damaged, people can still learn from the implicit memory, suggesting that repetition and spaced intervals that a similar treatment would work for Dory. The portrayal of the disorder is partially correct. The movie accurately shows her struggling to form new memories and forgetting things is representative of anterograde amnesia. However, comedic aspects of her push an extreme and unrealistic version. More broadly, as most people may not meet people with such mental conditions, movies can shape our impression of what the condition is like. When a film exaggerates symptoms, many people may have misleading ideas. In this case, how memory loss is funny or it lasts for a few seconds. But positive portrayals can lower stigmas and increase empathy. Here is my works cited and references, and thank you.